Recording, Paul.
That's the recording started.
That's great. Thank you very much. Welcome to the meeting of East Lothian Integration Joint Board on the 22nd of February 2024. The meeting's been recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018, and data collected as part of the recording will be retained in accordance with the Council and Health Board policies on record retention. The webcast of this meeting will be publicly available for us up to 6 months. Okay, I just want to say that we will have our business meeting, and then we will have at the end of the business meeting we'll have a 10-minute break, and then we'll rejoin again for our development session this afternoon, which is just for IJB members only. Okay.
Okay, I'll go on to the apologies and the roll call now if you're happy, Chair.
Yes, thank you.
Okay, we have apologies from Maureen Allen. We also have apologies from Elizabeth Gordon and our new voting member from NHS Lothian, Patricia Cantley. We have substitutes for both. Peter Knight is going to substitute for Elizabeth, and George Gordon will substitute for Patricia. So I'll cover them when I do the roll call. When you hear your name, if you could confirm, please. Councillor Actor.
Present.
Councillor Finlay.
Present.
Councillor Jordan.
Present.
And Councillor McFarlane.
Present.
Thank you. Andrew Cogan.
Present.
Peter Knight.
Present.
Thank you. Fiona Ireland.
Present.
And George Gordon.
Present.
Thank you. Do we have David Binney? Yes.
Present.
Yeah. Lindsay Byrne.
Present.
Thank you. Philip Conaglan.
Present.
Sarah Gosner.
Present.
John Hardman.
Present.
David Hood.
Present.
David King.
Present.
Claire MacDonald.
Present.
Claire McIntosh. Oh. Marilyn McNeil.
Present.
Thomas Miller.
Present.
And Fiona Wilson.
Present.
Thank you. That's the roll call completed. Can I ask if any members have any declarations of interest? Andrew.
Yeah, it is proposed that I become the vice chair of this group, so at the appropriate time I shall withdraw from the meeting.
Thank you.
I declare an interest in relation to the item relating to the appointment of the unpaid carers member, and will withdraw from the meeting at the appropriate time.
Thanks very much, David. Any other declarations of interest? Nope. That's us ready to start the business, Chair.
That's great. Thank you very much, and welcome to George Gordon and to Peter Knight, and thank you for substituting for the IJB members. That's much appreciated. I'll move on to agenda item number 1, which is the minutes of the East Lothian Integration Joint Board meeting on the 14th of December. Can we agree the accuracy of these minutes? Agreed. If you could just nod your head. Thank you, that's agreed. Can I ask if there's any matters arising from the minutes on page 1, page 2, page 3, page 4? On bottom of page 4, I know that we discussed the full transfer of services to East Lothian Health and Social by March 2024. I just wanted to ask about progress with the transitional management arrangements in place in the run-up to this date.
Will I come in, Chair?
Thank you.
Yep. So we progress continues. We took another paper back to NHS Lothian just to confirm that they were keen, just given the kind of the changes since last August, that they were keen that we progress. That has been signed off by NHS Lothian. The transition arrangements are still planned for that 1st of April handover, and we're just in the process of just working through it from a kind of process perspective from an HR. So it's all kind of set up to be heading in the right direction for the same dates, Chair.
Okay, thank you. Move on to page 5, if there's any matters arising. Page 6. Councillor Jardine.
Thank you. I wasn't at the meeting, so I wasn't part of the discussion, but under item 7, it says clearly about the extent to which things were airing into operational matters, and it's not entirely related to that, but I just wondered if there was any consideration of the council's budget intention of removing £275,000 from the adaptation budget, if that has a knock-on effect for this item.
I can come in on that, Fiona Wilson.
Yeah, I've not had a conversation about that, Councillor Jardine. I'm aware of it, and there's a meeting set up with Wendy Maguire and myself and Leslie Berry and Sarah Fortune. So that's the stage we're at. But apart from that, we've not progressed that further to understand the impact.
Okay, I think in the budget line it's to work with Wendy Maguire and the Care and Repair Service to look at how we review that contract, and I think some of the points were highlighted in the last meeting. Okay.
Popped yourself on mute, Chair.
Page 7 and page 8. Okay, thank you for that. That's all the minutes of the last meeting, and we'll go on to the next agenda item, which is 3, the Chair's report. There's been quite a few things happening. I took part in the interviews for the carers rep, which we'll go on to later on in the agenda. You will have seen just most recently the Audit Scotland report that's been produced of the future of health, and that might be something we want to circulate to IJB members for information. There also, since the last meeting, has been an NHS Lothian board meeting, and you may have seen information on that in the public domain around its revenue and capital programmes over the next 2 years. No support for capital programmes for the next 2 years, which was the message from the meeting. Also, there'd been a workshop on local economic development strategy for East Lothian, so I was able to attend to look at how we look at the supporting the skills and development, particularly as having an ageing population, of how we use those skills, particularly in supporting health and social care in East Lothian. And finally, which is always an ongoing area, is just taking every opportunity to highlight the good work of East Lothian IJB, but also to highlight the challenges of the East Lothian IJB faces. So we had the opportunity to speak to the Convention of Scottish Local Authorities, their presidential team, which represent all local authorities, and we had the opportunity to engage with the chair, Councillor Morrison. And so Councillor Morrison is a former member of NHS Grampian and a former member of Moray Integration Joint Board, so it gave us the opportunity to highlight to her the work that's going on in East Lothian and how important the levels of resource that we require in and also in managing the increase in the level of services that are required for the growth in population. So those are just some of the things that have been happening since the last meeting. And then, so most importantly, the last one, which is quite a lot of my time has been spent in covering supporting the East Lothian Council budget, which some of those things have already come through. So there's been an agreed transfer of £100,000 to the IJB to support the full costs of the 23-24 pay award, and I'm more than happy to go through the papers in more detail if any IJB member wanted to do that. I'm happy to do that with you in a one-to-one if that would be helpful to you. And I just want to ask if anybody had any questions. Thank you. Move on to agenda item number 4, which is the appointment of Vice Chair and change to the voting membership report. And is that yourself, Fiona?
Yep, okay. Thank you to just present now. I'm just conscious of Andrew. Does Andrew need to leave at this point and come back in?
I think he's gone.
Has he left? So, sorry, I was too quick and then paused. Yeah, so thank you. So here I'm here to present a report on the new Vice Chair and change to the voting membership. The purpose is to seek agreement from the IJB for the appointment of the new Vice Chair and to note a change to the NHS Lothian voting membership. The background to this, you will see the scheme of integration for the IJB states that the Chair will alternate with the East Lothian Council voting member, and as an NHS Lothian member every 2 years. The chair is currently held by a council voting member until the 31st of March 2025. In December 23, NHS Lothian Board appointed Andrew Cogan as its leading voting member on the IJB with effect from the 1st of February, and Mr Cogan was also nominated to the role of Vice Chair of the IJB and so the Chair of the Strategic Planning Group. And in February 2024, the NHS Lothian Board agreed to appoint Patricia Cantley as voting member of East Lothian IJB, effect from the 7th of February, and she replaces Peter Murray, who retired in January 2024. So the recommendation is that the IJB is asked to agree the appointment of Andrew Cogan as the new Vice Chair of the IJB until the 31st of March 2025, and note the appointment of Patricia Cantley, replacing Peter Murray as a voting member of the IJB representing NHS Lothian. I'll pause there, Chair.
Thank you. Do we have any questions or any comments? Councillor Finlay?
Yes, thank you, Chair. Just for my own information, what is the appropriate nominating body and who sits on it?
So if I understand it, we have four members, council members that make up the voting membership for the IJB, and 4 NHS Lothian non-execs that make that up, and it's representation from the council, and they will nominate, and then NHS Lothian will nominate, and then there's an alternate between the chair and the vice chair. So it's the NHS Lothian board that decides on these appointments. Does that answer your question?
Yes, it does. Thank you very much.
Thank you. Councillor Jardine?
I just want to sort of commend both appointments. Having met Andrew and worked with him for the last little while, I've found him extremely focused and very direct in his manners, and it'll be a pleasure to work with the esteemed geriatrician Trish Cantley in the future, as I have done in the past. So it'll be happy with both those appointments.
Thank you, Councillor Jardine. Do we have any other questions or comments? I don't see any. Yeah, I echo your comments, Councillor Jardine. I think Andrew Cogan has made a really valuable contribution since he's been on the East Lothian Integration Joint Board, and I had the opportunity to meet Dr. Patricia Cantley at the NHS Lothian Board. So in the short conversation that I had with her, I know that one of her passions is tackling poverty and early intervention and prevention. So that was good to have those conversations with her and have somebody that has an area of interest in those. Okay, I don't see any other questions or comments. This paper requires a roll call, so I'll pass on to you, Fiona Curry.
Thank you. I'll just come to each member individually. Councillor Akhtar.
Agreed.
Councillor Finlay.
Agreed.
Mr. Knight.
Agreed.
Thank you. Ms. Ireland.
Agreed.
Councillor Jardine.
Agreed.
Councillor McFarlane.
Agreed.
And Mr. Gordon.
Agreed.
Thank you very much. That's the recommendations approved unanimously, Chair.
Thank
I'll
you.
just email Andrew to ask him to rejoin the meeting.
Okay, thank you very much. While I'm coming to the meeting, I don't see him in yet.
While we're waiting, Chair, just say that I'll be covering the next paper, Paul Curry.
Okay, thank you. I'll just give him a couple of minutes to come back in. Mr. Knight? Oh, sorry, it's David King that's put their hand up.
Yeah, sorry, I was just thinking about Councillor Finley's previous question. It's actually all laid out in the integration scheme, you know, who appoints whom to where. So just, you know, whilst we're waiting for Andrew to come back, just a piece of intelligence there.
That's great. Thank you very much. That's appreciated. I see that you're back into the meeting now, Andrew Cogan. Just to congratulate you, the East Lothian IJB unanimously approved your appointment as Vice Chair of the Integration Board. So congratulations. Okay.
Thank you.
Move on to paper number 5. And is that yourself, Paul Curry?
It is, yes.
Has David left the meeting, David Binney? Because he's declared an interest in this one. I think he has.
Yes.
Yes. Apologies. Yeah.
Thank you. Yes, this paper mirrors the previous paper. It's asking the IJB to agree the appointment of a non-voting member to act as a carer representative. And the background describes the means by which this has happened. The IJB agreed in March of 2016 that we would have a selection process for non-voting members that would involve advertising and interviewing for the positions. And in line with that, an interview process was carried out, which had the IJB chair, vice chair and chief officer interviewing, and following interview, they recommended that David Binney be appointed to represent carers. The appointment is proposed for the maximum term of office of 3 years. And those of you who know Mr. Binney will know that this is a reappointment to a position that he has held previously. So the recommendations of the paper for the IJB approval is to agree to Mr. Binney's reappointment to represent carers in East Lothian, and to agree that his term of office should be 3 years duration. Thank you.
Thank you. Do we have any questions or comments on paper 5? Councillor McFarlane?
I'm just so glad to see David carrying on in this role, as he's done a very good job previously. That's all I would like to say. So glad to see him carry on.
Thank you. Thank you very much, Councillor McFarlane. Do we have any other questions or comments? I just echo the comments made by Councillor McFarlane. David Binney went through an open recruitment process, and he's over the last 3 years made a really valuable contribution to East Lothian Integration Joint Board, and I think we will benefit hugely from having been a former chair of East Lothian, carers of East Lothian, and his feedback and his experience will help us as we move along, because we know how valuable the voice of carers is for East Lothian IJB and the work that we in moving forward. Okay, one thing I was going to suggest is that as part of his reappointment, I think it's important that we engage with the comms officer to allow this appointment some press coverage, so people are aware of the appointment that has been made and are aware of his role, and that they can approach him on carers issues should it be something that they want raised at the Integration Joint Board. Okay. I don't see any other hands for any questions or comments, so we'll move on to the roll call, because this requires a roll call vote. So I'll pass on to you, Fiona Curry.
Thank you. I'll come to each member individually. Councillor Actor.
Agreed.
Mr. Cogan.
Agreed.
Councillor Finley.
Agreed.
Mr. Knight.
Agreed.
Ms. Ireland.
Agreed.
Councillor Jordan.
Agreed.
Councillor McFarlane.
Agreed.
And Mr. Gordon.
Agreed.
Thank you very much. That's the recommendation approved unanimously. And I'll just
you.
email David and ask him to rejoin the meeting.
Thank you. Is that David back in, Fiona?
He's not appearing in my list of attendees, but can't see him on screen.
Give me a few more minutes to log back in. We'll just give him a few minutes to log back in, but we'll move on to agenda item number 6.
Yes, do you want me to cover that, Chair?
Yes, please.
Okay. Item 6 is the meeting dates for the IJB, the Audit and Risk Committee, and also the development session dates for the period from August 2024 through to June 2025. Members will have seen the report and seen the dates set out in the appendices, and these dates are now for approval. We have had consultation with the chairs of the IJB and Audit and Risk Committee, officers, and also I've spoken with colleagues who cover NHS Lothian board meetings and also Mid Lothian and Edinburgh IJB meetings to try and avoid any clashes. So hopefully the dates are okay with everyone.
Okay, thank you very much. Do we have any questions or queries on this paper? No. Just to say, Fiona Curry, thanks very much for the coordination that's required to make sure that if people are on more than one IJB, that those meetings don't clash, and on other commitments as well. So I really appreciate that. This paper requires a roll call vote. So I'll pass it on to you, Fiona Curry.
Thank you. Councillor Akhtar.
Agreed.
Mr. Cogan.
Agreed.
Excuse me, Councillor Finlay.
Agreed.
Mr. Knight.
Agreed.
Miss Ireland.
Agreed.
Councillor Jardine.
Agreed.
And Councillor McFarlane.
Agreed.
And Miss Gordon.
Agreed.
Thank you very much. That's the recommendations approved unanimously, Chair.
That's great, thank you. Do you see Mr. Binney back in the meeting? Because I can't see from my screen if he's here. And Paul?
Let's just say I've phoned David to ask him to come back in the meeting. He is trying. He's having some sort of technical hitch, so he's aware that you've emailed him, and he's trying to come back as soon as he can.
Okay, thank you very much for doing that. Move on to agenda item number 7. Is that David King?
Yeah, thank you very much, Chair. Thank you. You've got the paper in front of you. Actually, I was just thinking back to your previous remark about the council budget. This paper doesn't mention the council budget, and we will have to wait until we get a formal letter from the council, and we'll pick all that whole budgeting thing up in the March paper. The £100,000 you mentioned is really useful. Obviously, I think members are aware there's a kind of bit of interesting way of arranging the financial settlement this year. There was a presumption in the Scottish Government's budget setting processes that an element of pay awards would be covered by, for example, the council. And clearly, we move into social care by the IJB. And then when these pay awards were in excess of that level, I think it was about 3%, then they gave the councils additional money. And so that additional money has now been passed on to the IJB, and that's a kind of a top up. And that, as I say, that's really, really useful. But it's one of these things we have to work through. And the other thing I need to say is what you're told not to say, which is to apologise at the beginning of any presentation. The table at the back of this document is full of acronyms and kind of presumptions that colleagues know what it means, and clearly that's a bit ridiculous. And I have lost count of the number of times where I've been asked not to do this. So I apologise to the IJB, and we'll come on to that table before I finish with this paper, and I'll just try and clarify what it tries to say, although we can come back to it later on if that's required. So we're on a journey here. As you know, we're working towards setting a budget for the next financial year. We're working towards setting a 5-year financial plan. And the sort of point we're arrived at the moment is to look at the 24-25 budget setting process. Now, I've said this before, I'll say it again, you know, we're a strategic planning body. We're not, in a kind of strange sense, interested in the current year's financial position unless it is means that our partners aren't able to deliver our strategies through our directions, or alternatively, it impacts upon the next financial year. Now, again, we've reported this before. The financial challenges in the year are very, very significant. And one of the other things this paper does, in fact, is sort of talk a little bit about the budget setting process and how that's impacted on 24-25, especially in NHS Lothian. And colleagues have seen all these presentations before. But we're continuing to update the 2023-2024 outturn position. It's, to be brutal about it, not getting any better. And if you simply look at point 3.3, I've simply laid out the current position. And one of the things we'll have to move to very, very quickly now is to have a conversation with our partners and say, well, what does this mean? What's going to happen at the end of the financial year? You'll remember I have said before that the integration scheme is very clear. If the partners do not have any further resources, then we have to move into our own general reserve in order to fund these processes. We now need to talk about that and how that works. That is not what we're here to talk about at this particular point in time. The second thing then on my list of bullet points, which kind of segues into the third thing, and again, if you look at 3.16, and what we've done here, and it's really, really important to, and I apologise for saying this, and I say it all the time, but all these numbers are constantly being revised. They are, after all, forecasts. And so we've tried to have an audit trail, you know, where did you start? Where are you going? What's different? So this is, as the time this paper was written, the most up-to-date financial outturn forecast. And that first column is a restatement of what the 2024-25 gap looks at the time we wrote this. Now, I'm not going to go through all the individual lines, but what we have done, exactly what we said we would do, as further intelligence became available, we would revise the numbers. So that social care position, 5.9 million, is better than the previous forecast because we have gone right back and had a fundamental review, and a huge amount of support, by the way, from colleagues, some colleagues in NHS Lothian, but colleagues in East Lothian Council. I'm really grateful for all that work. Had a fundamental review of these pressures and gone back again, because although this position is hugely challenging and we've got significant financial challenges here, then it's really important that the figure we start off looking at is as realistic as it can possibly be. And that's what we will continue to do. And we will continue to do that right up to the budget setting process. And that March paper will inevitably look slightly different from this. The second column then, and we had that tremendously useful workshop, and we had that opportunity, that development session, to chat through ideas and explain what everything meant and understand how we got here and reflect upon what kind of things we can do about it. Is we talked about grip and control and efficiency, and those are, in principle, programs that are being carried out by the operational management teams that do not impact upon the strategic plan. In principle, they should not, and therefore will deliver financial benefit to the system. Now, you can see, again, there's a significant amount of money. And one of the things that we all need to be absolutely clear about is just exactly what are these things, and are we sure that they don't impact upon the strategic plan? And what that leaves us then is a remaining gap. And we discussed this at the workshop. And one of the things that we wanted to do again was have another workshop, and we're going to do that, as the chair said at the beginning of this conversation. We're going to do that in the second half of this particular meeting, and just sit down and go back through some of these issues and have a further conversation about them. As I said at the beginning then, I need to go to Appendix 1 and page 25. Now, oh, sorry, that's page 25 on my copy. Now, what we said at the very, very beginning of this whole conversation, a couple of papers back, was the IJB has reserves. And it has two bits of reserve. It has about £5 million of earmarked reserves. And that is money that is being carried forward for a specific purpose, earmarked. And some of that money is coming from previous years, which we are carrying into future years. Some of it's carrying from current, well, I say current year, it's probably all coming from previous years. So basically you get the money in year 1, you spend it in year 2, maybe year 3, depending on how long a project or a particular piece of development takes. And then there are the general reserves, again around about £5 million. In principle, those reserves are at the gift of the IJB, although, as I say, in practice, the IJB is going to have to use these reserves in order to underpin its financial pressures in the current year. And the only commitment we've made against that is an agreement to underpin the costs of the analog to digital conversion. That is the conversion for the home alarm system. So let's just see what the first part is. So if you look at that first part marked earmarked reserves, what you look at the line that says earmarked, you know, that bolded line. So we started the year with £5.1 million of earmarked reserves. The committed column, what the committed column means is we've gone through all of these individual lines and spoken to the service managers who are using that money and said, how much are you going to spend in the current financial year? And the answer to that question is 3.9 million, it's just under £4 million. And therefore, at the end of this financial year, we will have £1 million, give or take, in our earmarked reserves. So that's the message. And I apologise, it's one of these tables beloved by accountants. I'm beginning to wonder if it's beloved by accountants because nobody else knows what it means. Now, the acronyms, where I'm extraordinarily guilty, let's just run through these individual things very quickly. Now, I don't want to waste the committee's a great deal of time on things that I should have expanded in the first place. Equally, I don't want to skip over things just because I don't understand them. So we've got the general managers in the room. So if I start A, requiring a prompt, or B, say things that are incorrect, please, general managers, step in and correct me. I shall try and do this quickly. PCIF, Primary Care Investment Fund. Those are funds given to the IJB over a period of years by the Scottish Government, which are to be invested in developing the primary care system. Action 15, just interrupt me, by the way, when I drift off. Action 15, again, are funds given by the Scottish Government to the IJB to invest in mental health services. ADP is drug and alcohol stuff. We all know about the MELDAP, Lothian Drug and Alcohol team. So this is the funding source for that. Again, it doesn't necessarily all get spent in 1 year. So if there's an underspend, we carried it forward into the next year and we worked through that project. As you can see, by the end of 2324, that's all finished. USC stands for unscheduled care. There's a whole lot of unscheduled care programs. Unscheduled care is obviously a delegated function, but it comes in different ways. That first particular one is for the community system, for InReach and QUIC. And I am now forgetting what QUIC means. Community, oh gosh, prompt me somebody.
Care when it counts.
Sorry?
Care when it counts.
Care when it counts. Thank you, John. Thank you. So that is investments in that particular project. And again, you can see that those are running into 24-25. Immunisations are self-explanatory. ICAT, I think, is integrated care and treatment. Integrated care and treatment, yeah. And again, that money is being cast into next year. And I say, if you want, why is it being cast into next year? We can come back and tackle that and get the general managers to explain that. We can circulate that intelligence background. The committee, unscheduled care, again, this is the NHS Lothian unscheduled care project of which we are part. Community Living Change Fund Reserve, well, there we go, there's one that actually opened up and that's done, that's correct, that's being spent in here. Carers, again, money from the Scottish Government to invest in carers. We haven't spent it all yet, we'll carry it forward and do that next year in support for carers, you know what I mean. Care at Home, that's money from a previous point in time which we've been using to develop the Care at Home programmes. Interim care, the same thing. Mental health recovery renewal. Again, we haven't spent those monies, not entirely clear why. LEAP is the residential drug and alcohol service, and that was quite an ambitious service set up so long ago that I was still here. And it's proven to be very, very successful. Again, this, I guess, is our last year of investing in it. We've got money to expand the primary care estate, which is a little bit counterintuitive given we don't actually own the primary care estate, but the Scottish Government are giving us money, and clearly the managers have got plans to use that in a sensible way. Similarly with premises improvement, primary care immunisation team, again, that's, I guess, a bit of a hangover from COVID and a whole redesign of the way we manage immunisation. Dementia and post-diagnostic speaks for itself. These are local unscheduled care programmes. I guess there's a whole gang of programmes underneath that. Again, we can open that up if it's necessary. MACH, somebody very kindly explained that is mental health after COVID. It's interesting, I talk about COVID sometimes as if it's gone because the funding for COVID's gone. COVID has not gone. All the things that we did in order to manage the COVID things, some of these things continue. Part of the financial challenge in 23-24 and going forward is continuing to deal with that COVID tail, if you like. Where are we? Scottish Government District Nursing Programme, self-explanatory. AHP is, oh, what's it called for? Allied health professionals. Initiatives, a whole gang of initiatives there. GPs, that's again investing in that whole ambition to try and improve the way that people interact with the GP practices. And then a little bit of money for unpaid carers, protective, what does PPE stand for? Protective equipment, I think we all know that. So just to summarise, start off with £5 million, money carried forward for specific projects. In this year, we spend 4 million of it, and there's £1 million left over. And I guess, and I will do this, I guess we should work out just exactly what that is, and then put in a paragraph perhaps when we come to look at the end of the year position, either in March or April. Now, I've probably spoken far too long, Chair, so I apologise for that, but I think it was worthwhile, as I say, A, apologising for not having enough detail there, and B, trying to clarify it.
Thank you, Mr. King. I think it's important to have gone through them and explain what each heading was, so that's been really helpful, so I won't apologise for that. I just want to open up for any questions or comments. Councillor Jardine?
Yeah, just a couple of things. I appreciate the explanation around how we will reach our budget. I suppose I'm conscious that we work with two different big bodies who get their budgets established at slightly different times. Now, I think I understand why there's difference in scheduling of them. That I think it's because the local authority, as a body that charges for services, needs to give advance notice, so it has to make its budget decisions earlier. Can you clarify that that's the right assumption, and just whether that a consideration in terms of our overall strategic approach, whether that offers us any particular challenges or opportunities?
Yeah, you're absolutely right. So the local authority, so the IJB is governed by exactly the same governance arrangements as the local authorities. The local authorities have to set a budget. Well, actually, you make a really, really interesting point. The local authorities have to set their charges by the end of the financial year. And as a matter of good practice, what they also do is set their budget before the end of the financial year. So they set a balanced budget before the financial year into which they are going in March or February, in actual fact, most of the time. And that includes his charges, and part of those charges are also the council tax, although the council tax has been frozen, but all of those things have to be going through. We are governed by exactly the same set of regulations, so we should also be setting a budget before the end of balanced budget before the end of the financial year, and that is what the IJB has endeavoured to do. The rules around the health system are different. NHS Lothian, all the health boards have to break even by the end of the financial year. Now, I mean, all systems are complicated. It's just a matter of size. The health system's slightly bigger, and complicated because of all the different parts of it and all the different regulations covering different things. the NHS Lothian doesn't have an allocation for general medical services as we sit here, because the way the Scottish Government managed that thing. Now, that might sound like a fairly trivial technical remark, but this is all the GP practices and all of Lothian. No, these are significant amounts of money, significant financial challenges in there. What it does is it tries to build up towards that process, to build up towards the end of March as best as it can, and it feeds that information back to the IJBs. So the IJBs, to come back to your point, Councillor Jordan, can set a budget at the end of March. And then what NHS Lothian will do is in April, at their April board meeting, they will set, it's not going to be a budget, it's going to be their financial projections, their final financial projections. Of course, it's going to be a budget, but their final financial projections for 24-25. And that will indicate how they are planning to get to a break-even position by 31st of March 2025, and the challenges in arriving there. I know that's a bit of a wordy explanation, but simple stuff. Councils and us set a balanced budget before the beginning of the year. NHS Lothian have to break even at the end of the financial year, and they work towards that process slightly more gradually.
Okay, thank you for that. That has actually been extremely helpful. I suppose the second part of my question there was about, does it offer us any particular challenges or opportunities?
Yes, sorry, I completely forgot about that. It offers us challenges because we're not setting, you know, we can't say what NHS Lothian's position is before the end of March. Not because they're being malicious about it, just because they haven't quite got there yet. And that used to cause us considerable considerable anxiousness before. But I think as we move forward, as we've sort of grown used to what we're doing and accept all the risks in the process, then I think we just write down what the risks are, and then we move forward on that basis. So it does cause a little bit of confusion. I don't think it causes any more risks than we've ever had before. And I certainly think we just need to move forward with our partners and just move on, start to tackle issues of 24-25, already tackling them, but start to sort of, you know, get that process and train and documented out, and everybody can see what's going on, and you know, this whole public transparency, you know, publish these documents, bring everyone into the tent.
Okay. Chair, if you beg my forgiveness, I've got two more questions. The next one, Mr. King, is in terms of, I know you've expressed that we're going to have a development session after this around the next stage of the planning for it, but I suppose I'm very mindful that spend doesn't stop for the process of budgeting. And I suppose, how have you got anything you can share just now about how we aim to establish that balanced position as quickly as possible within what seems to be a relatively brief timescale?
Yeah, I mean, you make a really good point. The management, I mean, there's various bits and pieces of this. First of all, the current position, you know, I keep on going on about 23-24 position, and that casts forward 24-25. Management teams across the whole of the system have known about that since Q1. So they're working on recovery programs. And if you extract all the other things in this process, if there was nothing else going on, we would be working on recovery programs anyway, just for that particular element of cost. So that work is going on all of the time. NHS Lothian, you know, obviously who are sort of joint managers of the Health and Social Care Partnership along with the council, are put all sorts of quite reasonable, you know, challenges to their management teams, and saying, right, we need to develop all of these things, and then having developed them, that won't close the gap, we need to develop more. So that process is going on all of the time. Nobody is, I mean, the only person who's sitting around here actually waiting for information to be fed back to him is me, because I'm aware of all these people going out there doing all these things, and I'm saying, right, that's great, you know, let me know where we are, let me know where we are, so I can make sure the governance works in the proper way. I just think we just need to keep on going through these things and just not let this one go. And the other point, of course, is I keep on sort of talking about NHS Lothian. All the set aside, all the hosted, it's not managed by the Health and Social Care Partnership. So I'm also in a kind of step away from that. And I have been having communication with colleagues in NHS Lothian as well. And I appreciate there's some in the room, but I mean, you know, people are not in the Health and Social Care Partnership and saying, right, where are we with this? Where are we with that? How are we going to look at set aside? So that work is carrying on. I mean, nobody is stopping about this.
Okay, thank you. And my last one sort of leads on from that. Appendix 2 of your paper indicates the sort of grip and control and efficiencies element. I suppose in the interests of transparency, again, wondered if you could explain what sort of things might be covered by both income and non-pay.
We're planning at the workshop to open that table up, because you're right, it's not the best table I've ever produced, and it's not terribly clear, and these are just lumps of numbers with not really dreadfully good narratives against them. So we will come back and tackle that question in detail. But income is a mixture of two things. You know that until, well, in fact, you know, until relatively recently, the government's policy was to stop having non-residential charging. Now, I guess because we want to stop having non-residential charging, maybe people had taken their eye out of income a little bit. Now that and the policy has now been put in the back burner, we need to step up and make sure that if we're due to get income, then we try and get that income, you know, in a reasonable way. I mean, you know, but we need to step that up. So some of that is about recovering income that's due to us, and some of it is about reviewing charging. Now, charging is the really sore point, I think, with IJBs. IJBs have no authority over charges at all. All the functions that are delegated from social care from the council to the integration joint board, the one function that's wholly excluded is charging. So we have no influence over that whatsoever. However, management teams, the Health and Social Care Partnership and the council are perfectly well aware that this is a thing. So there's work going saying, should we increase the charges? Should we have charges for things, you know, other services that are going on in the background? And the decision behind these charging will be A, made by the council, and then B, there has to be a dialogue with the council. Will these charges come back into the social care budget and then into the IJB's budget? So that's what the income is. And then non-pay is a huge range of stuff across both health and social care, where there's, again, it's probably easier to talk when we see that particular information in the next meeting, but it's things that are literally not pay. And, you know, is there a better way of doing this? Is there a better way of doing that? Are we buying these things and we don't need too many of them? It's all that kind of fundamental housekeeping revision. And there's, as I say, I can't off the top of my head remember all the details, but I know we're going to tackle these details when we come back again in the second half. So it's not a terribly good table. I do apologise for that, but I was aware that we were going to have this further investigation later on.
Okay, thanks.
Discussion, I should say.
Councillor, do you have any other questions, Councillor Jordan?
No, sorry, I don't.
That's okay. Do you have any other questions or comments on this paper? Can I go back to your comment on the set aside? There's areas that we have control over and areas that we don't have control over, which is the set aside. Could you talk us through what we are able to do to understand that better for us in East Lothian?
Yes, set aside is an ambition. So the core stuff, you know, the health services delivered by Fiona's team for the people of East Lothian in East Lothian, that's easy to understand. And and the temptation, of course, is for the IJB to get involved a little bit too much in that delivery, and it's an operational thing. And, you know, you've had all these conversations before. Hosted, again, is relatively easy to understand. I always think the really easy hosted example is the Royal Edinburgh Hospital. Here's a big central hospital providing care for people really challenging mental health issues. There are beds in that hospital that belong to East Lothian IJB, therefore that fund is given to East Lothian IJB, and East Lothian IJB metaphorically buys these beds. And we had a paper here 2 years ago. We looked at redesign of the Royal Edinburgh Hospital and how much beds we were getting, and there was a financial benefit came out of that, because if we were using fewer beds, then the way the charges or the budgets are moved around the system was changed. Set aside then is about functions, delegated functions, unscheduled care being the classic, but the functions that are not delegated to the IJB are trauma and surgery. So everything that happens, the Western, the Royal, St John's, that is not trauma and surgery, and I appreciate there's a whole lot of grey areas in there, is delegated to the IJB. Now, again, the absolute classic, easy one to understand, at least in my head, is the emergency department. So the emergency department is delegated, the function is delegated to Integration Joint Board. Part of that set aside, that's an overspend, by the way, that 2917, but part of the set aside budget is for our share of the emergency department. And the argument there is very, very simple. So people turn up at what used to be called accident emergency, and we all know the significant pressure that system's under. If the IJB had put strategies in place to try and keep these individuals safer or in their own homes, or, you know, they weren't having to hurtle down the A1 and end up in the Royal Infirmary, and I appreciate if you're having a heart attack, there's no choice in the matter, then the attendance at the emergency department should either flatten out or reduce. Now, as that moves, then money can come back across that particular part. So it should, effectively speaking, every time we take a pressure out of a service that's delivered at the Royal, that's represented by set aside, so geriatric beds, if we still have geriatric beds and all these kind of things, then that money should in theory move up the page into our other services, so the IJB can do with it whatever it wishes. This set aside is a method to drive forward the balance of changing the balance of care. One of the targets that comes right out of the last 20 years, change the balance of care. People do not want to be in acute hospitals. Acute hospitals are not a good place in which to be. Acute hospitals are hugely resource intensive, also tremendously useful, but hugely resource intensive. If we can take the pressure off acute hospitals, then we can use some of these resources in the community, and then you have this virtuous spiral where you know the system will flow more easily. That is what set aside is all about, and I apologise. That's possibly the worst explanation I've ever heard.
No, that's helpful. That's helpful. Fiona Wilson.
I was going to come in and maybe rescue David a little bit, just to give a couple of examples on that. So from an East Lothian perspective, so the InReach programme and the work that we are doing around the we're doing around the huddle every morning contributes to making sure that we have East Lothian people on the right pathway at the right time. And we're seeing that knock on because we're largely using under 90% of the acute bed base. So there's a kind of a question for us that we will come to around actually the more how we resource it, how do we support people? We're doing the right thing, meets our strategic plan. Have we got the resources, and do we start shifting the balance, maybe around conversations around AHP or just that direction? And the other example is a really good example where we've done that well is around MSK. Less people are going centrally for specialist physiotherapy because we're delivering it in East Lothian, and we've seen a massive shift from people having to attend the Royal Infirmary because they can go locally, and that again all sits in that set aside as two really good examples that we want to get into around kind of challenging where that resource would be, because what we're wanting to do is help the people of East Lothian, but also help a system around making sure we get people to the right place and there's access for people in the right place. So hopefully that's helpful around two positive examples where we're doing well in East Lothian around some of these set aside conversations.
Okay, thank you. And just finally, David, just on page 25, you have the opening balance committed for 23-24. So we're in February or near the end of February already. How realistic is that list of spend between now and the end of the financial year?
Again, I'm fed this information by my colleagues, but I mean,
Okay.
I have every confidence. I would be very surprised if it's terribly different at the end of the year when we do the annual. Sorry, the beginning of next year when we do the annual accounts for this year. I'd be terribly surprised if it's very much different from £4 million, give or take.
Okay, is that something that's been monitored, that if there is any potential slippage or the committed amount might not be fully
No, it's a really good point, Chair. I absolutely appreciate that. I can assure you that people have crawled through that list and said, are you sure that that money is still required? Because if the answer is no, then it can drop into the bottom line. And that list has been gone through at least, well, to my knowledge, at least twice, and I guess that my predecessor did that before I started. So yes, we've done that particular piece of housekeeping.
Okay, thank you. I just want to check if there's any other questions or comments on this paper. No, I don't see any other hands up. I think we've gone through before where the overspends are, where the challenges lie, both for health and social care, that are outlined in this paper. Just want to thank everybody, all the service managers and their contributions towards pulling this together. I think it's been a really challenging time with all the different messages and the information that's coming through around what's happening with the public sector finances. I'm really keen that those areas that are committed, that we keep monitoring them to ensure that if there is any spends that are not committed and can be put back into the reserves are done so. Okay. This paper doesn't require a roll call because it's just for noting. So are we happy to note the paper?
Happy.
Yes. Okay, thank you. That is that is the end of our meeting. So what we'll do, it's nearly 3 o'clock. So if people are able to join back into this connection at 3:10, and that will be for our development session, and our development session is just for IJB members only. So I really want to thank everybody for their attendance and their participation, and I'll see you in 10 minutes time. Thank you.